I'm so happy. I'm struggling to think about the fact I'm going to have to deliver some sort of professional, sensible presentation now. But I'm Beth. I'm the Director of Patient Experience and Community Engagement at Barts Health NHS Trust. And whilst it's our name, this is very much a partnership. We're just half of the story, and I'm here with...
I'm Emmanuel Gotora. I'm the lead organizer for Telco, which is the founding chapter of an organization called Citizens UK.
So a bit about our partnership. So as Emmanuel has just said, Citizens UK are a people-powered initiative, bringing together member institutions. They've got over 50,000 people. In fact, do you want to tell people about Telco, not me?
So Telco is 85 civil society organizations across 6 East London boroughs. We've been around since 1996, and I guess we're best known for creating the London Living Wage.
And Barts Health is a group of 5 hospitals providing specialist and routine care to people across North East London. And what might be a penner first, so our partnership's very much been driven by Afsana Salik, who is a senior community organiser at Telco, but was seconded into Barts as a community engagement officer. And she can't be here today because she's given birth this morning. So Afsana's had a little baby girl, so that's why she's not with us today, and I think that's quite a legitimate excuse. So why Health Equity Action Leadership, HEAL? So COVID-19, the pandemic highlighted and exacerbated existing inequalities and barriers to how healthcare was accessed and experienced and received. Barts Health knew it needed to do something different to reach communities that had previously been underserved and also were suffering more and weren't accessing vaccinations. Telco mobilised quickly in response to help Barts Health reach those underserved communities, along with other local trusted community and faith leaders. That worked so well that we wanted to continue the partnership, and Barts Charity funded Afsana to come and kind of work between us for 2 years to strengthen this and build stronger relationships and start to rebuild some of the trust that had been lost during the pandemic between the healthcare system and our local population. But we didn't just want to kind of hear from people. HEAL wanted to engage and develop the local community and the leadership capacity of the local community to play a role in transforming health services and be better equipped to tackle health inequalities with us and foster community ownership of health outcomes. So for the project, we really modelled ourselves on Citizens UK change model. So strengthen institutions, develop leaders in the community, and organise together across difference. So Barts Charity were very brave. They didn't really know what they were funding when they started because this was a fully co-produced project. So Afsana ran structured listening in trusted community spaces, which were primarily telco organisations. She went out into local spaces, spoke with local community members, but then also crucially came into Barts and spoke with a lot of our staff across the organisation as well, across our hospitals. And what really emerged through that listening was a complete disconnect between what we could offer as a health service to make our services more accessible, so some of the things that we could do to make things easier for people, and public awareness of those initiatives. And so through a steering group with telco members, they came up with the HEAL champion role. Do you want to talk a bit about that?
I'll just summarise really, because the HEAL champion role is mostly about putting or recognising that people in the local community do have power. We define power very simply as the ability to act. And the idea behind the HEAL champion is really recognizing people in local communities. We work with institutions, so churches, mosques, schools, universities, recognizing that these people actually have leadership, hence the name. We also think that it's important how you name the thing. It's like, you know, we're going to act on it, and we're going to recognize the leadership of the people. So the HEAL champions in their home institutions actually host what we call HEAL hubs. And it's recognizing, again, the place of a civil society institution in actually making sure that the people actually own their own health. The idea of HEAL is actually making sure that health and wellness is part of the dinner table conversation.
Yeah, so our HEAL champions, they receive bilingual training in health literacy. So Barts kind of delivered, this is how you navigate Barts Health, and then Telco gave the champions training in community organising skills. And then they go back to their communities, they have conversations, and the whole idea is that we empower them to navigate our services as users, but also as transformation partners. And crucially, this isn't just about one-way signposting. This is relational sharing. So the champions and the HEAL hubs, they feed their insight directly back into Barts Health. It's built now into our governance structure for experience and engagement. And that steering group continues to guide us. So just a few, there's a lovely quote there, so you do read that, but also one of the things that we did was before the training, 87% of the champions, so these are people who already think that they can come in and sort of engage with health services, 87% were not at all confident in giving feedback or finding information about healthcare services, and at the end of the training, 100% were very confident in both. We've got a little video because at the end of the project funding, we held an assembly to award the champions with their certificates and to recognise and celebrate them. And one of our partners generously donated this video to us. It's a bit small because it's optimised for mobile phone, because we find that communicating with local communities often is, it spreads much easily if we do it through WhatsApp and different other ways of communicating. So it's not optimised for desktop, but I'm hoping someone's going to do that for me, or do I do it? I press the button. There we go. And I should say that we held that assembly in the East London Mosque, who are another one of our HEAL partners. So in terms of next steps, do you want to take this?
Well, actually, it's been quite an unusual, what I would call a cultural experience, because we were learning about the culture inside Barts and how that works, and Barts were learning about our kind of relational approach. So, again, I think like other speakers have said, partly it's about funding, and we're hoping, obviously, that this accolade will help in that respect. But we're actually holding a formal evaluation. I know Barts are very good at evaluating, we're not, so they've actually arranged for a formal evaluation to take place, and that the steering committee will actually guide the development for what happens next. And we are also recruiting the next batch of HEAL champions and expanding the model across telco and beyond. So we are in 6 East London boroughs, but we're also part of a national organisation of over 500 organisations across the UK. And we will be taking this back to wider. And then really also deepening the relationship we have with Barts, but also building on top of it. We don't think that HEAL is just a project. We think HEAL can be a movement, and that's basically where we're going.
Thank you. Yeah, so if you're interested in Citizens UK, they've probably got a chapter near you. So our key learning, and these are Afsana's words, so start with relationships, not services. We really didn't know where we were going to go. We didn't know we were going to end up with a Hill Champion model when we started. We got to this point. Oh, I'll go really quick. Okay, 2, train and empower local leaders. It really has been led and driven by the local community. Co-production leads to stronger outcomes, obviously. Embed equity at every level. So for us, and for me especially as the director, this was about making sure that I didn't step in and direct things, but we allocated the resources and the decision-making where it should be, which was mostly not with me. And then partnership is power. It is an absolute joy to partner with Telco, and I would really advocate for everybody to work with their local community organisations. Thank you.
Thank you so much. Wow. Another wonderful presentation, thank you, and thank you for being so clear. I would love to take questions from the audience, please. There's a lot to cover in there. Yes, there's a question here. The lady in black, about 6 rows back, don't know, maybe 7. Yeah. And then any other questions, just so we get a sense of where we're going next? Okay.
Hello. I don't want, it's not a question, it's just to say what an amazing project you've put together, so really well done. But I also think people need to recognise the value of the voluntary sector, because there's huge wealth and value there, and I think we need to be working closest between secondary, primary and community care. So really, really well done. Thank you.
Thank you.
Yes, thank you. Great. There's a back over in the far right corner. That's okay, it's good exercise. She's building her steps up today. I'm saying it's okay, I'm not doing the one walking.
Another absolutely fantastic project. You've spoken really compellingly, and you have the results of building those effective community links and, you know, empowering the community to become champions themselves. What would you say is the biggest challenge in establishing that relationship?
Very good question. I think the early days of establishing the relationship, it felt like we were speaking different languages, even though we meant the same thing.
Yeah.
So it was really about, and I think the role that we had between Barts and Citizens UK really helped to translate what is really meant when we say this or when they say this. And I think that role as a unique role really, really worked for us. So having somebody from our organization almost seconded into Barts, and we were actually co-managing the role, which really worked well for communication. But I think that was the initial kind of teething problems, if you like. But once we managed to sort of navigate those differences, again, one of our priorities is organizing and building trust across difference. And that was really helpful for us to kind of think about, well, how can we actually find common ground? And really at the end of the day, what really mattered is what the people in our institutions really wanted. So we had to make it work for that reason.
Perfect, yeah.
Great, thank you very much. Thank you.